started.
Wonderful. Thank you,
Thanks, Monica.
Thank you very much. All right, well, welcome back, everyone. Oops, I got a little ahead of myself there. So thank you again for reconvening for the Pennsylvania Cancer Coalition portion of our day. So this part of our meeting will start now and take us through till about 1:30. As you heard, this part is also recorded just for future reference and all of that good stuff. So I am one of your two co-chairs. So I'm Kate Mostowski, and also our co-chair, Lynn Robertson, is here. And so for just with this time that we will be spending as a full coalition together this afternoon, sorry, we will kind of take you through conversation. Our work groups and subcommittees have prepared some good information to be sort of conversation drivers, if you will, for us as a full coalition. One of the things I just want to make reference before I pass this baton to Lynn officially is saying, you know, in future meetings, really in our next meeting, what our goal is to do is have that bit of in a virtual world, but structured similar to how we used to meet pre-pandemic. So we do have the technology to push us into breakouts, and we will look to do that. So as we sort of kicked off 2021 with our first quarter meeting, we did want to start off with some of that jointed conversation. As you heard earlier today, that was something that we did hear from our membership as part of the survey, even just feedback to us regarding just really finding it very helpful and meaningful to really learn what the other teams are doing, have some of that conversation. So we will be looking to this team to really be part of that conversation, engaging, and really just drive conversation. So I'm going to officially turn it over to you at this point, Lynn.
Okay, I'm ready. If
right.
You could advance the slide, please.
Absolutely.
First of all, what a great morning. I can't say enough about, I get so energized at these meetings. And I think one of the nicest things about the meetings is really it gives me a lot of fuel to go back and actually do and engage certain groups and help other groups to even get engaged with each other on the ground where the real work is done. So it's never, ever, ever hurts to kind of review things. So we're going to go over some of the slides we went over in December because there are new people that come to the meetings each time. So you can see here that the PCC organizational structure and that there is an executive team that is made up of numbers of co-chairs from the various committees and some of the staff from PA Department of Health, and we meet regularly. And you can also see the various subcommittees listed there. And from those subcommittees, the priority areas that we're all very familiar with the Cancer Control Plan: prevention, screening and early detection, diagnosis and treatment, and quality of life. And many of you, if not all of you, may be on one or more of these committees. And if not, we're always looking for new committee members, so you're always welcome. And most of the committees do meet virtually. They meet regularly, and they are really very well organized. I sit on several of them, and I know policy committee said that they limit their meetings to 30 minutes or less, and they do, and so do some of the other committees. So next slide, please. So you can see that the PCC structure is governed by the CAB bylaws. I've already alluded to a little bit about the executive team, which is comprised of the PCC co-chairs, priority area leads, subcommittee co-chairs, and the CCC program director, and we do meet quarterly. The work groups work on specific cancer issues, and the subcommittees provide subject matter expertise for the work groups and the PCC at large. Next slide, please. So again, I did list those various subcommittees earlier, and you can see their communications and how they inform the public of the PCC work. There's the Disparities subcommittee now that engages with all the work groups and health equity initiatives. Relatively new group, but a very, very active and a very necessary group. Evaluation, which actually deals with enhancing PCC operations and updating members on the cancer goal achievement and review program performance. And I also take the opportunity right now, while we're talking about evaluation, at the end of the session today, you're going to be asked to please complete the evaluation. And it's been made very, very simple, and we need that feedback. So keep that in mind. Membership actually recruits and retains members. And then we have the policy committee, which we heard from this morning. Next slide, please. Okay, I'm not going to go over the various leadership. It just only changes or where there is a need for a co-chair. So you can see in Disparities, we have a vacant slot and are in need of another co-chair. Again, serving as a co-chair several times, it's not a difficult job, and we highly encourage, if you have an interest in this area and would willing to co-chair, to contact Sharon Sowers, or, you know, at least somebody, if you don't know how to reach her, so that we can get you in touch with her so we can move this forward. Next slide, please. And I'd like to welcome some of our new co-chairs in a minute after I speak a little bit about colorectal cancer work group. Kate and I currently co-chair that work group, and so we, as co-chairs of PCC, technically need to step aside, so we are in need of two co-chairs for that group. In the meantime, we continue to support that group and move the work forward. We've had some other leadership changes, and we'd like to welcome Dr. William Kalo to the HPV work group, and also two co-chairs to the Men's Health, Brian Jones and Fern Gilkerson. Next slide, please. Kate, I think this is where you take over, Kate.
Absolutely, and thank you so much, Lynn. And just even to piggyback on what Lynn has shared as around just those new changes to our subcommittee and work group leadership, as well as even just really what our driving force is for us moving the whole entire cancer plan forward. You know, we are really we really look to that and what the groups can do and those needs related to there. And so there's a lot of moving parts to these, and we are so if there is that interest, you know, we would definitely want to hear from you, as you can see there, and we're really excited for those that are new in place. And again, welcome. So now what we would like to do is really just use the rest of our time to have this conversation. So what this slide is in front of you is really what will be our guidance tool for the little bit more than an hour that we do have as a meeting remaining. So this is around just that continuous dialogue around how our coalition is moving the cancer plan forward. So what we have asked the committees, or subcommittees and work groups to do is prepare a few minutes to really start not only sharing, but the engagement and conversation with our coalition today. So as we sort of see the theme of our first meeting of 21 being a little bit of a carryover from December, how we close the year is often also how we start the year. So we thought that this would be a good sort of modeling to continue this conversation as we move and begin this 2021. Kind of hard to believe it. 1 year ago, our world's really changed, and so much of that has also impacted the work that we do through our coalition. And so it's a very timely time for us to be speaking about this. So we will allow for the leadership to each of the subcommittees and work groups to share a few moments, and then they, after they conclude their few moments, we will then open it up for a few minutes of coalition dialogue with each team. So we are going to start with our subcommittees, and then we're going to go in this order here, kicking off with a little continuation of this morning with our policy subcommittee. So Emma and Ruth, if I could ask for you guys to come on board to talk a little bit about the policy subcommittee, a little continuation, if you will.
Great, thank you so much, Kate. This is Emma Watson with ACS CAN, and I am joined by Ruth, and we are really excited to talk with you a little bit about some of the work of our subcommittee. So I wanted to start by just elaborating a little bit further on the Cancer Caucus presentation. If you were on this morning, we let you know that this is something that we're working on with the new chair, Valerie Gatos. We are going to be presenting to the group on March 31st from 1 to 2. And per the request of the new chair, we have prepared a presentation on the impacts of COVID on cancer. So we have Kate moderating the event. We have Lynn kicking it off with an overview of the coalition and the burden of cancer in the state. And then we have Dr. Reyes from UPMC to talk about implications on screening, and Dr. Lopez from Jefferson to talk about telehealth. So we're really excited about this opportunity to engage lawmakers on this topic, to foster some good discussion, and really try and establish a schedule for reoccurring education sessions for members. In addition to this work with the Cancer Caucus, we have been tracking legislation at both the state and federal level. On the state level, we are monitoring the budget process. So we've been tracking budget line items related to tobacco control funding, funding for breast and cervical cancer screening, funding for regional cancer centers. We did have some initial concern about the potential for funding cuts, but however, Pennsylvania is set to receive a substantial amount of money from the federal stimulus package. We're hoping that this will offset some of the concerns, as well as provide some protection to the programs and services that are so important to patients and survivors in the state. In addition, we are monitoring legislation around prior authorization and step therapy. It's legislation that aims to cut down on the time that insurers spend reviewing a case and set some standard timeframes across all insurers in Pennsylvania. It also addresses step therapy, looking to create an exemption process where it's medically necessary for a patient to not have to go through all of the steps set by their insurer. We're actively collecting stories from patients and providers on the issue, and certainly would welcome your involvement. If you have a story or would be interested in engaging in lawmaker education in that space. On the federal level, we saw a lot of great progress around cancer at the close of 2020, so wanted to provide an update on some of that legislation. We saw Congress approve a funding deal that included an increase for research funding at the NIH and NCI. The spending bill included a $1.25 billion increase for NIH and a nearly $1.2 million increase for NCI. In addition, something that's often come up on these calls and that many groups have been advocating for a number of years, the Removing Barriers to Colorectal Cancer Screening Act was finally signed into law, which is very exciting. Furthermore, we saw Congress pass the No Surprises Act to prohibit surprise medical billing. This will go into effect in 2022. We saw the passage of the Henrietta Lacks Enhancing Cancer Research Act, and this will direct the U.S. Government Accountability Office to study federal policies that really directly impact participation rates in underrepresented populations in cancer clinical trials nationwide. And then one other exciting thing that was included in the end of the year federal package was the Clinical Treatment Act, which will require all state programs, Medicaid programs, to cover routine costs for care provided through qualifying clinical trials, and that will begin in January of 2022. So lots of good things in the cancer space happening. Moving forward, we're going to continue to advocate for increased funding for cancer research at the federal level, and are excited to see that the new administration has publicly come out and said that they are committed to doing everything that they can to end cancer, that it's a priority for the administration, that they're establishing a bipartisan group of lawmakers to talk about how to get it done. So it's certainly an exciting time to be a cancer advocate. And with that, I will turn it over to Ruth to talk a little bit about next steps, being involved, and certainly facilitate a discussion with all of you. Ruth?
Thank you, Emma. So you can all just see what a queen Emma is in the policy field, and it's just I have to say it's wonderful working with her. And so we get very excited in our policy subcommittee because it seems like we're turning the corner with some bills coming through, and certainly interest with the new federal administration. So we're sitting kind of in a nice place to be in this area. And one of the things that we have been talking about at the state level has been with regard to upcoming bills, and one in particular is Senate Bill 205, which is sponsored by Tartaglione, and she and also Senator John Kane. And this bill has to do, it's an act to provide for testing for dangerous levels of radon and for remediation measures in school buildings, residential buildings and residential homes and commercial buildings. And so that's very exciting. That's a great step forward to one of our overarching goals, not only for the cancer plan, but specifically for the policy subcommittee, in that, you know, creating these healthier lifestyles which will reduce cancers, and in particular with radon, lung cancers. And so it's just an example of how things are really moving forward, and we're just primed to move on more. So of course, we want to know from the other work groups, what other things are coming up? What else do you see in your area of specialty and knowledge that's on the horizon, that's kind of prime? And if you're aware of any bills that are being thought of or in the process of being written that we should be aware of?
Ruth, this is Lynn. I would like to just send out kudos to Nate Burden, Jackie, and a number of others who are actually on the ground working with that bill regarding radon. They are currently meeting with a variety of representatives, etc., in order to educate them about the bill. They've had requests to be educated about radon and its effects on health. And so I think this is an excellent example of a work group who's actually also not just at these meetings, but actually goes back to the community and continues to work both ways, in the community and to also help to move a bill forward.
Thank you for bringing that up, Lynn, because I did want to give a special shout out when I mentioned earlier today that, you know, when we do our policy meetings, we get an exchange of information. And in our last meeting, Nate brought forward these I guess they had a really busy day on Tuesday with this 3 or 4 different kind of webinars and learning opportunities. So those are the kinds of things that also come out during our policy meetings. And yes, kudos to all of that work that's going forward, because that's, I believe, Lynn, you mentioned in the meeting as well, and I think Nate also mentioned about the testing that has been going on in our schools, and that it's kind of not surprising, but alarming at the level of radon that is present in many of our schools. And, you know, our kids spend lots of time in the school buildings, and it kind of fits hand in hand with, you know, our guest speakers this morning from the American Childhood Cancer Organization as well. So it's a nice kind of point where we can work together to address an issue that has to do with children as well.
And Ruth, it's the lack of testing. It's not mandated that the schools be tested or the daycares. And that's what they're trying to push forward.
Right, that's what they're trying to do. But that Nate had mentioned, and I don't know if he's still on or not, that the levels that have been, I believe he said that there were 10 schools that had been tested.
Yes.
Last year, at the end of last year, and then there were an additional 20 that were going to be done by the end of the first half of this year, I believe.
I think so.
Okay.
Is this a good time to ask a question or offer some input, or are we waiting until the end?
No, this is a great time, Lisa.
Oh, great. Thanks. How did you know it was me? So this is Lisa Davis from the Office of Rural Health. I think that the work that this work group is doing is absolutely fantastic. And I'm wondering if there's been connections to what might be considered non-traditional groups that cancer might connect with, which would be, for instance, like the Pennsylvania Housing Alliance and other groups that are working to increase access to safe housing, thinking about radon and also lead exposure and so on.
And I don't know if Emma's still able to be on the call or not. Emma has some, you know, associations with her ACS CAN work, but we are always looking to build more relationships because, as I mentioned earlier, the more of us that come together with a united voice, the stronger our voice becomes. So yeah, that would be fantastic.
Wonderful. Well, perhaps we can talk offline because we've been connecting up with some folks who are working in public health and sustainability, which connects directly to issues like climate change and so on, and housing and other supports for vulnerable populations. So thanks.
And Lisa, along those same lines, in Pittsburgh, we have a very active group that is actually working along those same lines also. And members from the PCC actually are members of many of those groups. So it's you know, those sort of on the ground working groups that are working in the communities and working to make changes, and also with various levels of local lawmakers, etc.
That's great, Lynn. I would know that you were doing something like that.
Oh, this wasn't me.
I just you're a rock star. So there you go.
That's great.
So even if you can't think of anything right now, or as the discussion goes on this afternoon, if topics come up, just kind of give a shout out, or once again, you can send an email either to myself or to Emma, or just say, hey, I want to join the group and bring some topics with me.
Fantastic. And thank you so much, Ruth, to both you and Emma, and to the whole policy subcommittee. Really just excellent things going on, and we really look forward to seeing what's next. All right. Well, moving forward, I'm going to ask if Jen and or Lisa might be able to share a little bit about our communications group.
Hi, everybody. I'm Jen Pensinger, Executive Director of the Pennsylvania Breast Cancer Coalition, and I am partnered with Lisa Lawrence. Lisa, unfortunately, is away over the next couple of days, so she couldn't join us today, but she asked me to share what the communication subcommittee's been doing. We have been kind of restructuring a little bit this year. So last year, we really looked at how we could serve the Cancer Coalition the best, and, you know, really make sure that we were spreading all the good word about what, you know, this group is doing, because they're doing great things. And we wanted to make sure that, you know, not just we knew about it, that everyone knows about it. But it was becoming a little bit of a challenge. So what we did was we asked all of the different groups if they could share one of their members to sit on our committee, and that way we could really get, you know, some key input. So we were happy to know that we have been having some great people have joined our committee, and we need a few more. I think that might be on my next slide, but that we do need a few. There's a few committee. If your work group that doesn't have a member on the communications committee, we would love to have some new people join us. So we also we make sure gather along with Monica information for the PCC website. So if you have anything that your group or even, you know, if it's your individual organization that's doing great things, wants to share, please share it with us. And if we're able to, we would be happy to promote that on the PCC website and that type of thing. So we're, like I said, we meet once a month. Our next meeting's next Tuesday. I think it's the 4th Tuesday of every month. And our goal is to keep our meetings under an hour. And we do say, if you're on as a work group member, that if you just want to jump on and share some information with us and then jump right off, that's fine. We're not asking for a huge commitment. So I think that's it, unless anybody has any questions, or if they have anything that they want to share with us now that they think would be great to communicate with the rest of the group, we're happy to hear it.
And thanks, Jen. I think it's a great point too, and I put this in the chat as well, just that reminder for the great use of the website for our coalition, and that if there is updates, if we're looking for information or news, or even just wanting to help populate it's a great landing page for seeking information and populating information. Thank you for doing that.
We have a calendar for that website, so we do try to kind of hit on, March is Women's Health Month, or October's Breast Cancer Awareness Month. So we try to hit on the key months for the cancers, but if there's other things, we're always looking for other things. So we might be reaching out to your group, the men's health group, the genetics group. We might be reaching out to you at certain times to say, hey, do you have something to put on the web? So if you hear from us, please send us stuff.
Thanks so much, Jen. All right. just in thinking about more of this great content coming from our subcommittee. So I'd like to turn it over to Sharnita to talk a little bit about the Disparities team.
Thank you, Kate. Hello, everyone. This is Sharnita, Thomas Jefferson University in Philadelphia. So the Disparities Subcommittee is going to be very busy this spring and this summer. We have agreed to develop a series of brief reports on men's health with a focus initially on Black men's health in Pennsylvania. And those reports actually will be developed after we've had conversations with Sharon about an infographic that she is putting together to help educate policymakers about the status of men's health in Pennsylvania. So we're looking forward to getting engaged in that. And we have also been engaged now with Fern Gilkerson, who is our new chair, one of our new chairs of the Men's Health work group. She has asked us to present to her community health workers about lung, prostate cancer, and colorectal cancer screening, specifically for men. So I am teaming up with Arminta Washington, who is a member of the PCC and at the University of Pennsylvania, and we will present together on May 20th. So moving ahead, we are just waiting for the health report to come out from the Department of Health, waiting for Dr. Yang's okay on that so that we can perhaps get some of the data that we need for the men's health reports from the report they've already generated. And then we will continue to go a little deeper into the data and what it tells us for those very brief reports. And I just wrote down that COVID-19 has not impacted our strategy in any way. We're doing everything remotely at this point, and it seems to be working. Along with that, I want to give a shout out to Barbara Jackson, one of our Disparities Subcommittee members, who is the founder and president of Catalyst, an organization in central Pennsylvania devoted to educating about cancer and supporting cancer survivors. Her group just had their 25th annual educational event, all virtually. And it was just an amazing event a few weeks ago. They highlighted breast cancer and prostate cancer and provided an update on what's happening in those areas, and also some breakouts really focused on holistic health. So physical fitness, spiritual fitness, and mental fitness. So it was really great. And I actually wished I had thought about the communications subcommittee putting that out to everyone so that we could have even more people attend. So it was really nice, well organized, and COVID is not stopping us from doing the work on the ground. As you have heard, we do need a co-chair for this subcommittee. My friend Chrissy Villania has moved on to a new position, and I'm really happy for her, but very sad that she's no longer working with me as co-chair. So if anyone's interested, please just let us know. And in terms of Chrissy leaving, we now have lost our representation at various subcommittee levels. For policy and communication, she was attending those particular groups while I focus more on the data advisory committee and evaluation. So if anyone's interested in working with us as part of the Disparities Subcommittee and attending those meetings, I would greatly appreciate that. And going forward, we'll probably need a little help as we gather statistics, do some data analysis if needed, and write our brief reports. So if anybody's interested in being part of that writing group, we certainly would appreciate the help. So all hands on deck over the next several months. And that's all I have. Thank you.
Thank you, Sharnita. This is great stuff, and even just what's coming down the pipeline for what kinds of information can continue to drive our work to kind of go that deeper level that we have talked about. Questions for Sharnita and the Disparities team?
This is Lisa Davis. I don't have a question, but I do want to make a comment and a shout out to Sharnita for all of the work that she has done to keep this group moving forward, and to everyone who is on the committee. They've done a great job. So Sharnita, thank you.
Thank you.
And I echo missing Chrissy as well.
Yes.
And Sharnita, I love that you even note that COVID has not stopped you guys.
No, we're not going to let it.
Well, thank you so much.
Thank you.
All right, up next, we have evaluation. So Heather or Mark, if you'd like to share some stuff that's going on.
Sure, I'll share. So evaluation activities for the PCC CAB kind of have a cycle where we have a data reporting phase and then a data collection phase. So we've kind of started our data collection phase. So our main update is that we're getting the annual survey ready, and that's going to be coming up in May and June when we'll be fielding it. So we really hope that everybody on the call and all of your colleagues in the PCC will participate in the annual survey. We're very excited to hear from everyone, and we're hoping that it will be the biggest amount of participation ever. And I really want to note that the Department of Health and the PCC as a whole has been extremely responsive in trying to address all of the things that come up from last year's survey results. So I'm hoping that we can see if PCC members perceive that that is effective and what else is next. Moving ahead, we're very interested in COVID impact, although COVID is only impacting what we're doing a little bit, in that we had planned to do some interviews with subcommittee and work group leaders, but we've put that on hold given the unusual nature of the past year. And we want to try to be able to focus on what is going on with how COVID has been impacting the progress on the cancer plan goals, rather than doing that to try to get an understanding of what is normal functioning. We're always looking for new members, although I forgot to put that on the slide. So I'm going to put my email address in the chat so that you can email me if you are interested in joining the evaluation subcommittee. We have we have monthly 1-hour calls. And we try to be really organized and make the asks of folks specific so that we use time well. And you'll be able to see the plan for disseminating the survey and reporting results and interpretation up close if you join us. So I think that's what I have. I'm happy to field any questions if there are any.
Thank you, Heather. And I think what a great plug for just the continued need of feedback for not only our annual survey, but these meeting surveys, as Lynn noted in the beginning, that we'll revisit at the very end too, around just today's session. That information we really do use, so thank you, and to the evaluation team for continuously putting together these great surveys to solicit that feedback. And just us going over that, and not only as a coalition, but at all levels. But just really just application of it. So other comments or questions for Heather and team? Great stuff. Well, thank you again. And so to round out our discussion from our subcommittees is membership, which is definitely a continuous theme that we do have across our entire coalition when we talk about not only the needs for co-chair roles to be filled, to new folks that are coming on, but just kind of from every angling that we are looking to do to fill representation across our entire coalition. So I don't know if we have David or Casey or even Sharon, if you wanted to share any of the updates related to membership.
Is Casey on? Is Casey on today? Or David, before I say anything? Okay, I guess not. One of the things we're working on with membership is taking a look at the membership profile. One of the things we want to do is make sure that members of the coalition really match the priority area, the priority populations that we're trying to address. So one of the things we're doing with the new membership profile, you're going to see we're going to be asking more information on sex, race, and ethnicity, just to get some more information. Also, we want to know how many people are cancer survivors or maybe caregivers of cancer survivors. Again, why do we do this? We want to make our coalition stronger. We want to make sure it represents, like I said, the target populations that we're trying to reach. So we're working on doing that right now. So that's probably the biggest thing that is right now coming out of the group. I would ask all members that if you, in the meantime, something comes up, you change jobs, you change something, please let us know, because we keep a membership profile, and from that, from each of those membership profiles, we have a master list. And if you change jobs and you don't let us know you have a new email address or something, then we can't be sending out information to you. So please let us know. Satoko is always available. You can email her, you can email your co-chairs, whatever. But that's just our way of keeping everything up to date. Thanks, Kate.
Thank you, Sharon. Other comments, questions that you would like to pose to our membership committee? Well, wonderful, and thank you all to the subcommittees to really just showcase a lot of what's been going on, because it is very, even from the structure that Lynn shared earlier, that we are familiar with, or maybe even seeing for the first time, that our subcommittees really are cross-cutting across our entire coalition. So what they're doing is really those things that we're seeing in multiple ways across all of our work. So hearing about all of the different things that are going on from that subcommittee level really is reflective of a lot of the things that are going on at our different work groups too. So again, thank you to all of our subcommittees to showcase the work in action. Really appreciate that. So I'm going to switch gears to our work groups and have us go through a very similar format, but at the work group team level. And so to kick us off, I'm going to ask Lynn to come on to represent our HPV work group. They were actually meeting right now, so they're in action and unable to have joined our coalition today. So Lynn, I'm going to have you walk us through the updates related to that team.
Okay, happy to do so.
Thank you.
So the HPV work group has been very, very active, and it's a great group. It's a large group, and it has a HPV work group and a subcommittee, which is the HPV dental work group. So what they're highlighting here are actually a lot of the National HPV Vaccination Roundtable resources. So this information is online. It's very, very easy to access. It's also a wealth of information. It reminds me a lot of, if you've dealt with any of the National Colorectal Cancer Roundtable information. It's really practical, a lot of evidence-based things, etc., and things that can help make your job a lot easier in your community in dealing with the various aspects of HPV. Next slide, if there is one. Okay, so again, in relation to this group, there is a call to action for spring of 2021, and such things as a safe return to in-person schooling, and an urgent call for action for health plans to close the adolescent vaccination care gap. So not only are we really, particularly because this is a HPV work group, pushing to get adolescents vaccinated for HPV, but along with that message, we're also talking about getting vaccinations for these youth and young children up to date in general. So again, there are resources there. There are slides there that can be used. There's a recording. There's lots of things available at your fingertips that you can help educate your local communities. Next slide, if there are. And this is just more information about the toolkit. And as you can see, there's a number of infographics and some social media shareables, and also some letter templates, two in particular to use with parents and plans or providers or systems in regards to HPV and the importance of HPV vaccination. I don't know if you're aware, HPV vaccination is not a reportable vaccine. So we do the best we can, and the PA Department of Health has been very good at providing some data most recently on vaccine or HPV level of vaccination per county, and we aren't anywhere where we need to be in the state of Pennsylvania. Some counties are doing better than others, but our rural counties are way behind. There is lots of work to be done, and keep in mind, HPV vaccine is a vaccine, one of the two, that is cancer prevention, and not just for cervical cancer, but head and neck, anal, penile, and other types of cancers. So it's an important vaccine. Next slide, if there are any.
This is the last one, Lynn.
Last, okay, they just listed everything, but you can see here just some of the other toolkit additions that can be used. And again, I really highly encourage you to look on at that resource, because there are lots of things that are easy to use, and you don't have to reinvent the wheel. Thank you. Any questions? I do sit on this committee, so if you have any questions, I may be able to answer them. We're also looking always for new members because, again, as I said earlier, there's lots of work to be done.
Thank you, Lynn. I think, that speaks, I think, to right where we are, as we've seen a lot of even just recent news that the work group has shared out related to just vaccines in general, and how those things that are happening all over related to COVID-19 or not can have an impact on the work that we're doing related to HPV. So just really kudos to the work group, the continuous work of the work group, and even with the packaging of resources here, which should have clickable links when the PowerPoints are available to the coalition, where you can easily find them. Really great stuff. Any other questions or comments for Lynn and the HPV vaccination team?
Hi, Kate. Can you hear me?
I sure can, Diana.
Okay, thank you. And this is a comment and I guess a question, and you sort of already touched base on this, but as the COVID-19 vaccines roll out and are approved for adolescents, and the rumor has it that for the school year 2021-22, there will be a major push for the COVID-19 vaccine. And I just think that that's something we have to keep in mind as we move forward with our HPV work, and that the systems that we're working with and the priority hospitals that are doing initiatives, we might have to think about, there could be a pause in the work just because of this major, push, as if things go as the timeline is currently being presented for vaccines being approved for adolescents. But I know this group is already addressing it. It's just something I think we all should keep in mind, that we could see a pause.
Thank you, Diana. That's a very good point. So we could even be further behind, because you can't get any two vaccines together with the COVID, and you have to wait 14 days at least. So again, then we know how it is with adolescents. They don't get back to the doctors or back to anywhere to get some of the necessary vaccines that they need. So thank you for bringing that up.
Absolutely. Thank you. Other comments, questions for the HPV team?
This is Sharnita. Just a quick question. I'm wondering are we seeing any increase in the uptake among young men?
Yes, we are. When I look, and I do a lot of research in this area, and I currently am funded in this area. And when I've been monitoring the young males, and they are coming up, I have to say, consistently. not quickly, but consistently. So they're moving to the gap between them and the young females is less.
That's great. Thank you.
You're welcome. Thank you.
It's a great question. Oh, wonderful. Well, thank you so much for this dialogue. We'll continue, of course, to hear from this team as for all the comments made, lots of things happening in this space because of the great work that has been happening, but also with things that are in our sort of space of impact this year related to COVID-19. So great stuff. We'll be very interested in what happens next. I'm going to move us forward to lung health. So if we have Caitlin or Denise who'd like to share a little bit about what's going on with our lung health team.
Hi, this is Caitlin. So I am presenting for the lung health work group. So we really kind of focused on restructuring our agendas for these meetings to focus more on our strategies, the 3 strategies that we've developed to address lung health. And those strategies are planning for regional tobacco cessation providers to do more radon education through their cessation services, as well as year-round radon awareness campaigns, more focusing on the cancer concern rather than kind of focusing on real estate-driven efforts and campaigns. And then the last is to identify and promote lung cancer screening, education, activities, resources, and tools to smoking cessation providers and lung health stakeholders. So specifically around that last strategy, one of the larger things to mention is that there's a lung cancer screening white paper that's being developed. Hopefully will be coming out in about the final version coming out in about a month or so. And it focuses on the reasoning behind why to do lung cancer screening and how to incorporate lung cancer screening at healthcare facilities. There's also going to be a training coming out for primary care physicians on lung cancer screening, and it does talk about how to identify and refer individuals to cessation services as well. Moving forward, mainly talking about the COVID-19 impact on our work group, some radon testing and education as well as cessation efforts had been put on hold. But now moving things virtually and kind of readjusting, those efforts have started up again with radon testing as well as educational outreach and information. And cessation services have really started to do more virtually, and they've been kind of picking up as far as participation goes. And so the education at those services regarding lung cancer screening and radon education has picked up as well. In that same effort, Denise and myself will be working with the Division of Tobacco Prevention and Control on a training to all the regional primary contractors that provide tobacco control services in Pennsylvania, educating them on lung cancer screening and radon testing, the importance of it and how to incorporate it into their everyday work that they do, just to get some further education out there. And then what we're really looking to do is more of this education, just around lung cancer prevention through radon education and lung cancer screening. So just kind of wanted to put it out to the group. If anybody knows of any education opportunities or presentation opportunities, please let us know. We would love to just get more information and education out there and spread the word. So that's my update.
Thank you, Caitlin. I have a question for the online training. Will that be for credit?
I'm not sure. I can direct that question to Ron and we can get an answer for you.
Wonderful, thank you. Mm-hmm. Other questions or comments from the members?
Hi, I have a quick question. When you're looking for the educational opportunities, is it for large groups, small groups, any kind of requirements that you have for who you would go out to work with?
We don't really have any requirements. We're just trying to get any and all education out there. Anybody that would be interested in learning more about read-on education and lung cancer screening.
Okay. Thank you.
Yep.
Wonderful. And thank you so much, Caitlin. There's really great stuff as we've sort of seen the theme of lung health coming up a lot throughout our conversation today. Great stuff. Really looking forward to hearing and learning more about what this team is doing.
Thank you.
Next, we have survivorship. So if Amy or Stephanie would like to share a little bit about what's going on.
Hi, Kate. Hi, everybody. It's Stephanie. Can you hear me?
Yes, we can.
All right. It's a pleasure to be here with all of you, and I love hearing about the work that everybody's doing. My screen is still showing lung health. Would it be possible to advance it, or is that maybe just a problem on my end?
Let's see. I do have it at survivorship. I wonder, do other folks see lung health still or survivorship?
No, we see survivorship.
Okay.
Okay. Well, no problem. I have my slide pulled up separately on my desktop, so I'll just open that up. Well, I think that our group is going to have a very resource-oriented year, which I know resonates with a lot of other groups working on that in their way. I want to thank the whole group, from Amy and from me. We've added a lot of new members. There was so much energy, and we've had wonderful turnout for our first 2021 meetings, and so we're thrilled about that. So we all know our group and beyond, that people living with cancer, people living beyond cancer, find having access to resources to support their survivorship or wellness is really, really important. And of course, we know that's also very essential for their healthcare providers. And as I know many of you are aware, there's a Commission on Cancer standard that applies to accredited facilities related to hospitals and healthcare providers offering services and programs on survivorship, whether those programs are on site or by referral, that address the needs of cancer survivors. So for these reasons, our call to action this year, and possibly beyond, I don't think it's anything we'll ever completely finish, will be to develop a comprehensive resource hub for people with cancer, for their healthcare providers to use. And we envision that will include both Pennsylvania specific as well as national resources. So we just landed on that as our specific next step call to action at our meeting last week. So we'll be in our subsequent meeting talking a lot more about mapping out what the steps will be to support the development of that hub, identifying the categories of resources that we want to make sure to include, where will we locate the resources, what's our process going to be for collecting those, not only from work group members, but others, both in and outside of the PCC, we hope. How will we compile them and then present them and make the information accessible to the public? Of course, we know there is already a page for resources on the PCC website, which is great. So we'll certainly be giving a lot of thought to how we might work with others at the Department of Health and in PCC to add information and expand it. And then I think a really important piece of this too will be, how do we promote the information and get it out there? And I know that the Communications Subcommittee does a lot of work with promoting resources already, and we'll really be looking forward to connecting with other members of PCC for their guidance and for suggested resources as we move this work forward. So as I mentioned, our membership has expanded significantly. Of course, we too are always looking for more members. We are very interested in adding additional healthcare provider members representing the systems in Pennsylvania, and also representing additional disciplines within healthcare so that we can use their expertise to help inform our gathering and presentation of resources as we move this work forward. From a COVID standpoint, I think that we'll be able to conduct this work virtually and present it virtually, but we know that COVID has significantly impacted how a number of resources and programs across the state and beyond have been offered. So for that reason, if nothing else, we do think an updated compilation of resources is essential. And we'll also need to give thought to how do we get this information into the hands of people who do not have internet access, which is, I know, an ongoing challenge for any of us doing virtual or web-based work, is not wanting to miss people who may not have that same access as some people do have in our communities in Pennsylvania. So I think those are the major things that we are going to be focusing on right now. Like I said, we will certainly be reaching out to individual members of the subcommittees as we move our work forward and welcome input and thoughts, whether that's today or in the future, about relevant resources. Once we determine our process for gathering resources, we will be sure to let everybody know what that would be. And so just to make a distinction in the way that I think we're envisioning it a little bit differently than how the communications team is gathering resources, is that we would also be including kind of static organizations that maybe aren't only having a date specific event, but offer ongoing resources and programs to people across a very, very wide category. And that's what we want to make sure we have accessible. But I think there could also be some great overlap with what the communications subcommittee is working on. And I am a new member of that group, so look forward to talking more with them as we go forward. And I'm not sure if Monica, you are our contact, Monica Fisher, for technical and IT support from the DOH to talk a bit more about how we might create an online-based resource hub. But if so, we will certainly reach out to you probably in the coming weeks to just get some input from you on our next steps in that regard. So I think that is all I have, unless anybody has any questions or comments at this point.
Thank you so much, Stephanie. I think what you've mentioned as far as, those points about the resources where we've sort of made some shifts related to where we are currently, as well as really the assurances that there is such access to different groups that may not have internet. It's great stuff. It's very exciting to see some of these things happen and even what you and team have planned.
Great, thank you. Yeah, we're really excited about it. Like I said, there's been a lot of energy in our meetings, so we're very excited to kind of kick off this work. And I'll go ahead and put my email address in the chat as well in case anybody has questions or would be interested in joining the group. We'd love to hear from you. So thank you, everybody.
Thank you. Okay, so next up we have genetics, genomics. I don't know if Andrea or Alana are on. I would like to share a little bit about what's going on here. And I know some of this was even shared a little bit earlier in April's presentation. So April, I don't know if there's maybe anything you would like to maybe add on behalf of this team.
Sure. Just for an update of those that were not on the CAB meeting members, the work group has been working for over the last year, and the online provider toolkit will be available sometime in April. For genetics and genomics in PA, and we're really excited about that. Additionally, a Lynch syndrome patient toolkit has been submitted with Andrea Durst as the lead and one of her prior students that will be available. The work group has decided for 2021 that they will be developing a needs assessment survey of genetic and genomic counselors to better help service their needs, because we have with the impact of COVID and seeing what there may be with patient barriers. And that's probably the very highlighted overview, Kate.
Wonderful, thank you, April. Questions that the coalition would like to pose to this work group? Great, well, wonderful things also happening here. It's exciting, and thank you again, April, for the information, that little deeper dive earlier, as the really wonderful things to sort of see how they're growing and developing throughout this time that we've heard a little bit about some of these toolkits and such.
Thanks.
Okay. So next up, we have our colorectal cancer work group. So I'm going to kind of lead us, but Lynn, I'll also ask you if you want to add anything to come on board and add. As far as the updates, one of the things that I will say as far as the impact of COVID-19, we've certainly seen a pretty big impact of the pandemic on cancer screening as a whole. And certainly colorectal cancer has had has faced a big impact related to that. So a lot of what the members have been focusing on are really what those best practices have been. Where have we've seen those successes, and really highlighting those modalities and those strategies that have been working well, especially as we've sort of shifted to be able to respond to where people can maybe be more at home and things to that nature. And also just how, as people are going more into their care facilities, how do we navigate that too? So we're really focused on getting tools and resources out to the members around screening. And even just a little bit of a plug, and I can put this link right in the chat too, and you may have seen this, but even just some of the things that have been referenced from roundtables earlier, we have some similar things for coalitions and even others around just cancer screening as a whole. So really that tested messaging and just strategies related to how do we, get folks back into screening. So that's a lot of what we've been focusing on as a work group. So certainly the movement ahead is going to be a lot of those same things, that continuous sharing of best practices and learning from one another around what is working well. There is great stuff that is happening across our state to get people screened. So we definitely want to shout from the rooftops widely around where we have seen those successes and really work through where we've seen struggles. So just looking here, the continuous support of especially our primary care practices, as they are seeing a lot of the, the impact of really everything related to preventative care. So looking at what can continuously be done to streamline and really maximize on those opportunities when patients are coming in. And really just to put a plug in here, as mentioned, the biggest need and the kind of where we could stand some support is looking to fill those co-chair roles with the work group as we move through 2021 and continue with that movement forward as a team. So that's kind of where, if there's discussion, or Lynn, if you'd have anything you'd like to add in the space of colorectal cancer, would definitely like to open it up.
Thanks, Kate. Just one comment. I know colorectal cancer is something that I work a lot on with my team locally, and we've been very, very successful in getting patients, even through COVID, screened for colorectal cancer. And I think one of the biggest things we've learned over the years as we've been doing colorectal screening in a variety of ways is that follow-up is so important. And I know that it's labor intensive, but even recently at one small clinic that I support, I highly encouraged the staff to spend a few minutes going over the instructions, if you use a fit kit, Cologuard, or whatever you do, with the patient. And also, if they don't hear back from them, to call them within 7 to 14 days. And we went from probably a 30% compliance rate to 90% almost overnight. So I think it's important that we don't just hand out kits or just tell somebody to do something, but that we also follow through, because if it's important, that little bit of follow-up really shows that we care and that it is important that it be done.
Great point, Lynn. Absolutely. I think, some of the things around follow-up that were, known, or that we were, trying to do pre-pandemic, we've certainly seen the benefits of that continuous follow-up, the need for those touches with a patient, to, especially when they're doing those home kits, stool-based testing, to really, that follow-up really does help with that completion of the screen. Great point. Comments, questions for the colorectal cancer team? Okay, well, to round out our work groups in action, I'm going to advance us to the next and final slide with men's health. So if we could have their new members or co-chairs, either Fern or Brian, to share a little bit about what's going on here.
Hi, this is Fern Gilchrist, and I'll go ahead and share. I'm from Temple University, Harrisburg. Can everyone hear me okay? I first want to ask that.
Yes.
Okay, perfect, wonderful. I do want to thank you, Sharnita, for the highlight, and also thank you and Armento for agreeing to speak to the learners in the Temple Harrisburg Community Health Workers Training Program class. So we really, really appreciate it, and we're really looking forward to it. I do want to say I am very pleased to be here as a subcommittee co-chair for the Men's Health Work Group with Brian Jones. We've come up with a new plan for the work group. This may evolve, but I want to share really the essence of this plan with you. So our group will plan to prioritize and implement ways to reduce cancer rates among Black men in Pennsylvania. So we're going to plan to approach this goal in two ways. So here's our vision. We'll plan to promote the screening for lung, prostate, and colorectal cancers among Black men. And we'll do this by helping to get Black men into the healthcare systems to see their providers. And while they're there, get them, either screened or scheduled to be screened for these cancers. This will, as far as this plan goes right now, this involves a two-step process. One is the development of an online learning modules led by Temple Harrisburg, but informed by the Men's Health Work Group, really, that'll teach community health workers some skills, techniques, and approaches for promoting lung, prostate, and colorectal cancer screening and techniques for promoting the health visits. The module will encourage working with clients and patients, as well as working with those who are in healthcare settings to understand and respond to those referrals and the work. So it's sort of this two-pronged approach, working with providers and working with clients. So that's where we'll coach community health workers to do this. The other part is, of course, the incorporation of information on screening for these cancers into the actual Temple Harrisburg Community Health Worker Training Program. So that's actually one. The other part of this is to promote better protections for communities of color that suffer at greater rates of health problems due to close proximities and regular exposure to sources of toxic waste and other sources of carcinogens such as landfills, power stations, factories, waste facilities, radon, and then sprays such as pesticides, fungicides, and herbicides. So this approach may entail, and this isn't set in stone by any means, but this is kind of a list of the potential that this holds. This may entail supporting primary prevention efforts that stop health problems and prevent disparities before they start. Supporting community level advocacy and policy that protects communities of color from health risks associated with environmental toxins and carcinogens that are at the root of health disparities. The work group may also decide to develop a model policy that supports communities to address, reduce, and whenever possible, eliminate root causes of cancer-causing toxins and carcinogens in their communities. We may partner with the Disparities and Data Advisory Committees to identify those communities of colors where there are high rates of cancer and nearby sources of toxins and carcinogens. We may decide to partner with the Department of Environmental Protection to help us reach those goals. We may decide to connect with community councils, local community councils in places of high risk to understand their ideas and their needs. And we may decide to outline ways to hold sources of toxins and carcinogens in communities accountable, improve their compliance, remove the sources from those communities, and replace them with economically viable and non-toxic options through approaches such as community grants or local business startups and community gardens. So that's kind of the vision for this men's health work group moving forward. As far as how COVID-19 might be impacting this strategy right now, I don't think Brian and I can see how it is being impacted other than, in a positive way with our virtual meetings, opening this up to more people not that COVID is positive, but just looking at, you know, how, you know, we're moving into virtual meetings, and this opens up for people across the state that might have barriers for meeting in person otherwise. So yeah, as far as, you know, we're welcoming people in. Please let us know if you'd like to join us to help bring these visions into fruition. And Brian, I don't know if you're still on with us, but I want to invite you to just kind of say anything if you'd like to just say hello or add anything to what I just said. Okay, he might have had to hop off. Does anyone have any questions or thoughts?
Thank you. Oh, I'm sorry.
Sorry, this is Sharnita again.
Hi, Sharnita.
So I love hearing, we've been on email together, so I love hearing all of your thoughts about everything you're planning. She has a wonderful plan going
Thank you.
Especially with the community health workers. But I'm just wondering, has anyone mapped out any of these areas where you think there may be environmental toxins and made that link to cancers that are nearby? And do you think that these toxins have a differential effect on men's health as opposed to anyone else in those communities?
Sharnita, I have not mapped out anything yet, just being still very brand new on this in this co-chair position. So I would love to share in the future when we do find out those areas. And as far as differentials, you know, the focus, our focus right now is the lung, prostate, and colorectal. So I don't know about the big picture. Is that what you're kind of asking about? How does this fit in with the bigger picture?
I guess just how it links to men's health. I can see how it links to health more generally.
Right.
Specific about men's health, where we would expect men either be more exposed or that it has a differential effect on their health compared to others in the community. I'm just curious.
I'm not sure yet. I think there's going to be some overlap there with sort of that community immersion or that community risk factor piece, and looking at men's health and Black men's health and how that fits into that. I'm not exactly sure, so I'm sorry, I can't answer that yet, Sharnita, but I hope to be able to, again, sort of in the future.
That's great. And I think there are some members of our Disparities subcommittee that would be interested in.
Yeah. And I look forward to working with you to kind of unfold some of that.
Yeah. Wonderful. Thanks.
Yeah, you're welcome.
This is Lynn Robertson, and those questions are very, very complex. We locally in Pittsburgh have a cancer and environmental number of work groups, and plus working with our epidemiologists. These risks are very difficult to connect directly with most cancers. It's not like radon and lung cancer. It's more difficult with a lot of these other things. So work continues to be done, but I think we're a long ways off for actually connecting a lot of these things directly if you're looking for a direct contact, you know, a cause. So work being done, but it'll take time. But a lot of work is being done, at least in the Pittsburgh area, et cetera, to identify these toxic wastes and all these other exposures and to do something about them.
Right. And maybe we could talk, Lynn, and maybe I could kind of learn from what you're doing out there in Pittsburgh and kind of, you know, take it here and add to the statewide discussion about making these connections. Thank you.
I put my email in the chat.
Okay, great. Thanks.
Thank you. Great presentation.
Oh, thank you.
And again, thank you so much, Fern, and agree completely.
Thank
Great
you very
plan.
much for the support. Thank you, everyone.
Kate and Sharon, I just want to add something since I don't think Brian is on the call. He sent me some information. There is a national organization called Zero to reduce prostate cancer, and they are offering transportation assistance for men to get screened. So if you're from a healthcare system or something, you might be interested in this. Look for this information on the PACancerCoalition.org news maybe tomorrow or Monday at the latest.
Great.
Thanks
Thank you,
for adding
Sharon.
that, Darren. Yeah.
Well, and thank you to all of our work groups for sharing all of the great content, and to our entire coalition and all of the work that's going on. I can definitely say we are busy, really impacting so much of our state and to the communities that we do serve. So I'm really just smiling from ear to ear, hearing about all of this just momentum forward, thinking about the work in front of us and really just our plan to get there. And so I'm so thankful to be part of this team and with all of you, and really looking forward to the years ahead that we are planning to move these plans into fruition. And so with that, I have us at 1:30, and I'm going to transition us to more of our kind of wind down and close and keep to time. So just as was mentioned front end by both Lynn and Heather, we do want to hear from you. We want to hear, how did today go? Your feedback is critical to us. We really want to just apply that as we do. So you see here, we have a QR code, our second QR code as a Cancer Coalition, that is specific to our evaluation survey. So as you can see here, about 2 minutes. We're also going to put the link to this in the chat. So you can even do that now. We would hope that you can do this pretty much right away to, kind of get that off of your plate, but also use your voice. So that's coming to you right into the chat. And this will also be, if Sharon, correct me if I'm wrong, also provided in the follow-up, just in case. So you'll be getting multiple places in which we can fill out the survey, or link to the survey rather, and really encourage you to do so. So again, thank you for all of your continuous work to impact the communities that we serve throughout the state. Just incredible stuff. And I'm, again, so thankful for all that we do together. And I'll ask Lynn if she wants to come on for any final words before we call our meeting to close.
No, nothing more than thanking everyone for attending. I see attendance has been way up there the whole meeting, which is great. And please, if you really have any interests or any questions, reach out to Kate or myself, and we look forward to our ongoing working together and decreasing the burden of cancer in Pennsylvania. Thank you.
Thank you, Lynn. And again, if there's anything that, we are able to do, we want to hear from you. As you heard, the PA Cancer Coalition website is going to be our sort of landing space, our anchor for all things related to news, updates, or sharing of great content. So encouraging the constant, kind of using that as a touch point. We, of course, look forward to touching base between today and our Q2 meeting, which will be in June. If you have the schedule, you know that specific date, but you can also look forward to getting those communications from Sharon and Monica related to the actual date and the logistics for that meeting. So again, thank you. I hope that you all have a wonderful day, and take care. Thank you. And Monica, we can stop recording.